Hello everyone, this is Dr. Sultan Moinuddin Shaukat. I welcome you to IkraMed Learning Academy. Before we start, a brief introduction from my side. I am Dr. Sultan Moinuddin Shaukat. I have completed my MBBS, MD and DNB in radio diagnosis from prestigious SATE, GSMC and KM Hospital, Mumbai. I am a 14 gold medalist. Before this, you have seen my sessions on the basic ultrasound, ultrasound abdomen, ultrasound of thyroid, pelvic ultrasound, ultrasound in cases of infertility, etc. So today we are going to discuss in this series of lectures a special ultrasound which is based on fetal Doppler. So before discussing, so in this series of lectures we will be seeing how a basic uh, person would start doing ultrasound Doppler right from the very basics, that is right from starting machines to using the various keys available on the on the board of your ultrasound machine, that is various knobs, and I will also discuss the various knobs which are available for the basic grayscale imaging. And then once your grayscale imaging is perfect, the next comes is Doppler. I will also discuss in subsequent sessions the basic fundamentals of physics part of Doppler, which you are supposed to know. And then we'll discuss the various important application of that physics. Rather than going in too much of tedious details, I would discuss the application of that physics which is important for you to know, so that you achieve the Doppler which is valid Doppler. It means that if you get the velocities, or you get the PI or RI, whatever, so it should be valid. Okay, only then that Doppler can be taken of therapeutic importance. One thing which I want to tell you before we start with this is that radiology is an imaging science. Sonography is an imaging science. That is, you image a patient. Always remember that any results of the image are to be interpreted in view of the clinical scenario of the patient. So depending upon the clinical status, that has to be put on. Okay, and if there is a mismatch between the sonographic findings and the imaging findings, sonographic findings and the clinical uh, part of the patient, in that case you should review your images, and in those cases, very important, comes your radiological techniques which you have used. So sonographic techniques, maybe that you have measured the S by D ratio is high, or you say that the umbilical artery flow is absent, but there were technical problems. You had applied a lot of pressure. It could be possible that you applied a lot of pressure. It is possible that instead of measuring the uterine artery, you took it in some other vessel which has given a raised PI of the uterine artery. So in cases of fetal MCA, so there are lots of technical aspects, the physics part, which you are supposed to know when it comes to Doppler. And this is what makes Doppler, uh, you know, a difficult part, but we'll simplify it and we'll go right from the basic ABC. Okay, so in this session I'll be talking on the basic keys or basic knobs on ultrasonography, which you are supposed to know once you start the study of fetal Doppler. Okay, so let us begin. So when you speak of ultrasound machine, this is the keyboard which you have. Of course, these boards might differ from machine to machine, it may vary, but this is one of the, you can take, these are the keys in general would remain similar. Okay, there would not be much of difference. Nowadays there are machines where you have got screen touch keypads, and many of the keys they have put it in screen touch, so that becomes more comfortable, more handy, and it becomes more easier for selection, more fast as compared to what we had. So in this case, now let us see. So you have got a group of keys here. So these are all alphabetical keys, you can see here, these are alphabets. And this is just like your computer, PC or laptop. where you have this alphabetical keys and they can be used to enter the names, patient details, and if you're saving the case, in case what is the diagnosis. So whatever you make patient ID, once you start making a new patient ID, all the typing part would be taken care of by this. So you have got a spacebar key, enter key, shift key, and all the alphabetical keys. Again, you can make it small or you can make it capital letters depending upon these keys. Now, very important is there is a specific terminology, what we call it as annotation. Annotation. What is annotation? Suppose you are giving an image of liver. Liver का image दे रहे, then you have to title it that it is liver. Suppose you are showing a pathology in the right ovary, you have to mention that this is right ovary. That is called annotation. Similarly, annotation is very important. Suppose you get a very good case and you want to document it and you want to take images. So in those cases again, you can show an arrow and you can annotate that. That is called annotation. So just like in books we have images shown, there are arrows and the arrows are labeled. So in other words, you can say it's labeling. Okay. So it can also be used for annotation. Now you see here, there is a group of key here. You can clearly see this group of key. This is numlocks. So these are all number keys. So these are very important in all those scans where you have to put numbers. So can you tell me those scans where we have to put numbers? Very important, of course, where you want to enter age of the patient. Okay. Now, very important because there is a concept of teenage pregnancy. So in India, if you have pregnant female less than 18, it becomes a medico legal cases, and you should be very careful when you have a medico legal case. Okay. Now in all teenage pregnancies, MLCs are must, very important. Number two, these keys are also useful to enter specific dates. What are the dates? Yeah, can you tell me? Of course, you have got LMPs, you have got EDD. What is LMP? The date of last menstrual period. Similarly, what is EDD? Expected date of delivery. So all those dates can be entered depending upon the previous sonography of the patient, and this is useful to estimate the gestational age based on LMP or previous EDD. Okay, and that can be used for comparison in the present scan. Okay. So these buttons can be used. Now next comes in knob is this exam button, which can be used for selecting the particular examination like abdomen, obs, gynec, whichever exams you want can be selected. You've got a new patient ID. Then most important, now of course this is the session of Doppler. So in general, these above buttons, they can be used in any scan along with general. Now very important is this group of keys, this group of keys. So out of this is a focus button. So we'll come what focus helps in, but as the name suggests, this helps in focusing a particular area. Okay. Then you have this depth button, which can change the depth depending upon where the particular structure you want to examine is. Now we'll also see this in details in the further slides. Then you have got a filter, PRF, pulse repetitive frequency. So we'll see what PRF is when we come to details of Doppler. And then, so we often call this a scale. Okay. We often call this a scale. So very important, depending upon what you want to image. You want to image a slow flow structure or a high flow structure, you can put your scale. For example, just to understand, if you want to examine arteries, you will put a high scale. If you want to examine vein, you will put a low scale. Important. So this is a very, very, very important concept. I will also discuss this in details when we come to PRF. Okay. Next, you have got various buttons over here. So here you can see this is B mode. Then you have got THI, that is harmonic imaging, tissue harmonic imaging. You have got a color Doppler button. You have got power Doppler. So very, very important, this two, that is tissue B mode and tissue harmonic imaging. Both of this are the grayscale imaging. We'll discuss both of this. I'll show you the images also, not to worry. Point to be noted here is that if you see this two, that is the color Doppler and the power Doppler, the buttons are different. And remember, not just the keys or knobs are different, but power Doppler is different from color Doppler. Okay, बहुत ही common difference. Then one of the major difference is that in case of power Doppler, it is non-direction dependent. Power Doppler does not depend on direction, whereas the color Doppler, in case of color Doppler, angles and directions are very, very, very important. Okay, so basically, this is just like scalars and vectors of physics, what we used to study in our 11th and 12th days. So then you have got PW and CW, that is the waveform, the pulse waveform. So this is when you want to do the put a waveform in that. So I'll discuss in details what all these are. But remember that these buttons are for waveform. Now you can see these two knobs, they are for gain. So you can increase or decrease the gain just by moving it to the right and to the left. Now you have got time gain compensation, which is over here. So depending upon this, you can change the gain in particular area of the image which you have. Now let us move to other important parts of this keyboard, that is you have got a scroller. So this is just like a mouse or the scroller part which helps you to take arrow keys wherever you want. Next is you have got various other buttons, out of which very, very, very important is this freeze. Freeze button is a very important button. So freeze is a very important button. So when it comes to freeze, this is when you want to still down the image. किसी image को वहीं पे रोकना है. So when you want to make the image still, so that is the time when we use this freeze button. Okay. अभी very important. But suppose now you take a vessel, you image a vessel, उसमें color डालना है, that is to see the flow of that. You can put the Doppler in that and then you get the waveform. But to document it, you'll have to freeze it and then you'll have to save it. So that will be a save button also. Okay, then these are the print buttons, the save button which you have, so that the image can be saved within that ID. Okay. Now, suppose you want to zoom, so you have got special buttons which are zoom button. You can measure the distance. Similarly, there is a button of calculate. So there are various parameters that can be calculated. We would be seeing in Doppler, there are numerous parameters. Similarly, there are other calculations important for OBS like, CRL, measurement of mean sac diameter. All this can be done. When once you go in calculation, there will be a list of calculations which you get. One of the very important parameters, they are first trimester parameters and the second trimester parameters. Based on this, the calculation can be done. Then you've got ellipse, which is can be ellipse and trace, which can be used to calculate the area, etc., etc. A very common calculations which you do is calculation of volume in case of various collections, in case of uh, various cases. So all this is when these are the common buttons which we use routinely. Another very important button is the dual button, which is very important. Okay, dual. Now few knobs which are very important, the angle correction. So in this machine, these are the arrows which help in angle correction. Now depending upon machine to machine, this may vary. So we'll come to what angle is, but remember that there are knobs which helps you to correct the angle, and there are knobs which helps you to steer. So they helps in steering. So I will also come to what steering is and what it helps in, what is angle of inclination. All this concepts we'll discuss, but presently, what you should know is there are alphabetical keys, there are numlock keys, there is key for exam. Any exam when you are doing in an ultrasound, most importantly, you have to select the particular examination. For example, if you are doing an arterial Doppler, select proper arterial Doppler. Or suppose you want to do obs Doppler, select exam protocol of obstetrics. So this all is very important. Suppose you want to examine for fetal cardiac, take exam fetal cardiac. Okay. So all these are very important. Now, one more important thing which I would like you to see here in this image are this. So you can see that there are side knobs and where you have got this uh, nicely placed. So this is the convex probe, or this is abdominal probe. This is the probe which we routinely use for OBS, very important. So this probe is used for obstetric examination, and this is the same probe which we use for uh, obs Doppler, also fetal Doppler study. Same, this is convex probe is also used for fetal 2D echo, cardiac echo, etc., etc., fetal anomaly scan. So routinely we do it with this probe. Okay. Now this is the transvaginal probe or the TVS probe. Now remember that when in case of early gestation, if you see my lectures on early pregnancy failure, in case of how to diagnose pregnancy early, and in case of all gynecological disorders, so all pelvic pathologies, we advocate transvaginal ultrasonography. Now if you see my series of lectures, there is one more lecture where I have said even in advanced gestation when to go for TVS, when you want to measure the cervical length with accuracy, imaging cervix. So there is a separate session on that. You can go through that lecture, how to image cervix. Okay. So now here, and so I would like to brief you that there are three important probes, and mostly you have to select which probe to use depending upon the study. Okay. Next is you have got this SP probe. We call this SP, that is superficial probe, or some people call it linear probe. Okay. Or as it is flat in appearance, or some people also tend to call this as H high resolution probe. Okay. So whatever they call it, but it is routinely used for all superficial structures, limb Dopplers. Okay. So depending upon that, so now suppose you have got an abdominal scan. So which probe will you prefer, the abdominal or the convex probe? Suppose you want to examine for OBS first trimester, again you select the convex probe. You want to do OBS Doppler, convex probe. Suppose you want to do the scan in early pregnancy, you will take transvaginal scan. Okay. Again, if you want to look for uh, linear probe, when you want to look for superficial structures. So very important, very important. When will you take convex probe? When you want the more depth. The depth has to be more, especially in case of all OB scan and abdomen scan. So when you want more depth, that is the time when you use OBS and abdominal probe. Very important, remember the frequency of convex probe is low. So when the frequency is low, it is inversely proportional to, let us come to that. Suppose if you take TVS probe, the frequency of this probe is high and the depth is low. So frequency is inversely proportional to depth. So here the frequency is low, so the depth is more. Okay. But very important, frequency is directly proportional to resolution. Okay. So the convex probe, the resolution would be less good or less in resolution as compared to that of transvaginal probe. So TVS would have a better resolution. Okay. I will also discuss the term what resolution means, that is to see the two objects separately on ultrasound. Okay. That is called resolution. So if you compare the three probes, so convex probe has got lowest frequency, then you have got the uh, linear probe, and then you have got TVS probe. Okay. Routinely, some at some institutes, suppose you don't have a linear probe, you can use TVS probe instead of a linear probe. Similarly, but linear cannot work like a TVS probe. Okay. That is very important difference between them. Okay. So when it comes to resolution, better resolution, you should think of these two probes, that is linear and transvaginal probes. Okay. When it comes to depth perception, you should think of convex probe or abdominal probe. Okay. These are basic fundas which you need to keep it in your brain when it comes to which probe to select for particular examination. Now let us see the important knobs, and I will start with very basics so everyone can understand. So let us start with very basics. So which is the first button? First thing is you have to on your ultrasound machine. Okay. Once patient comes to you with PCPNDT, so first is PCPNDT F form. Okay. Once patient comes to you with PCPNDT form, next is you have to on the machine. So which button do you have for awning? to make the power button on, so you have got power button here. So here you can very clearly see you have to press this button. Same button is used in most of the machine to on as well as off the machine. So you can use this power button. Okay. Now switching on this machine, uh, so switching on the ultrasound machine is the first knob to press if the machine is switched off, very important. And by switching on the machine, the ultrasound system now gets the access to the source of electricity, and this activates the various crystals which are present in the machine, which are called piezoelectric crystals. Okay. So what is piezoelectric crystal? That when you pass electricity through these crystals, they change their shape, and because of this change in shape, because of passage of electricity, they generate a special waves which are ultrasonic waves, and these are ultrasound. Okay, ultrasound, they cannot be heard by human ear, very important. Okay, because the frequency is more than 20,000 hertz. Okay, now when this piezoelectric crystals emit sound as a result of their exposure to electricity. The sound waves produced by piezoelectric crystals are transmitted in the human body and normally aided by gel. So, very important is the ultrasound gel which is used when it comes to imaging of ultrasound. So, you have got a jelly bottle here. This is gel. Okay. So, gel is routinely applied to the surface over which the probe is kept. Why? Because if you put the probe directly, there will be air interface between them, and as a result, the air will hinder the transmission of ultrasound. So, to avoid, so decrease the resistance for passage of ultrasound, we apply gel. Okay. Now, so gel serves as the acoustic medium for eliminating the air between the transducer and the skin. What is transducer? It's what probe is also called as transducer. Okay, transducer is nothing but probe. Okay, again I want you to identify the various probes. So this is convex probe. For Orb's Doppler, you will be selecting convex probe. This is linear probe, and you have got this is cardiac probe, which is phased probe. Okay. Okay. Now, the next important button which we had seen is the exam button. So, now you have selected the probe. Now you will have to select what examination exactly do you want to do. This is also called preset button in some machines. Okay. So, you have to select the type of examination which has to be done, which type of examination you wish to do. So, by selecting the appropriate preset for the abdominal, the predefined factory setting are activated, especially for abdominal sonography. So, every machine has got a particular setup. So, like in case of GE or in case of Samsung, so if just as soon as you press the examination preset, you would be getting the various presets. So, I will show you an example like that. So, like in this machine, as soon, so here there is a system where you select the probe. So, this is convex probe, let me make it red. This is convex probe, this is linear probe, this is TVS probe. Okay. Now, first thing is selection of probe. So, you select the probe. So, here suppose I select convex probe because we want to study Orb's Doppler. So, here most important probe would be convex probe or abdominal probe. Okay, and now you see you will get the various presets. So, here are you able to see the presets? This is preset for abdomen. Then you have KUB, this is kidney, ureter and bladder. Okay, then this is another preset if you want to see, this is GB and biliary system, pancreatic system. Then you have got this for uterus, so gynecological ultrasound. Then you have got this is for pregnancy, obstetric imaging. Again you have got a special for obstetrics. Sometimes you have got special, in this machine actually this is for fetal echo. Okay, and then you have got other special, for abdomen and other imaging. So this is how you have got various type of presets. So most importantly, when you want to examine the OBS scan or OBS Doppler, which preset will you be using? You will be using OBS preset. Okay. अब सवाल है, there is a question for you. Suppose you select incorrect preset. Suppose आप abdomen में examine कर रहे हो OBS को, या abdo protocol में you are examining gynac. What's the problem? What's the issue? So very important that there are two indices. थोड़ा theory है, but you should know this, that there one is called thermal index and one is called mechanical index. So these two indices are to be kept minimum. So when there is ultrasound, ultrasound is an energy. So it has got mechanical effect. Similarly, ultrasound, it's an energy, it's a sound energy. So it has got some thermal effects. Okay, when it is transmitted in the tissues, it has got thermal and mechanical effects. तो हमें चाहिए कि thermal and mechanical effects are minimum, they are less. Okay, especially when the female is pregnant, especially in the fetus. So when it comes to OB scan, it is very important that you select the protocol with minimal thermal index and minimal mechanical index in order to avoid any untoward event in the fetus. Although ultrasound is very safe, theoretically it is possible that if MI and TI are kept high, especially in early pregnancy, it theoretical possibility that it might cause cavitation, okay, in fetus. But you should always try to to use correct protocols when it comes to fetal ultrasound. Okay, chalo. So with this, I would like to summarize what we have discussed in this session. Most importantly, we have discussed the various knobs, selection of probes and selection of presets. So your brain should be crystal clear. Patient comes to you, you position the patient, select the correct, you have to on the machine, select the correct probe, correct preset. Okay, very important before any ultrasound. Okay. So in next session, we'll continue with further parts of various knobs which are used for 2D, and then we'll come to Doppler imaging. Thank you.